Hello, my name is Trinique and I'm a registered dietitian specializing in public health nutrition. I was introduced to the field of nutrition and dietetics in high school, where I had the opportunity to intern at a local hospital. There, I had the chance to shadow different doctors and nurses on different floors. I knew that I definitely wanted to work in healthcare because I love to help people. But during that internship, I learned that I did not want to become a nurse or a doctor. So then I had the opportunity to shadow the dietitians at the hospital, and I remember being so intrigued by the fact that they were using food to help their patients' health. Food is something that is so basic because we have to eat to survive, but it's something that is also so special because every time we eat, we have an opportunity to really impact our bodies and our health. Once I decided to study nutrition in college, I learned that there are so many different things that you can do with nutrition. Obviously, you can work in a hospital, but you can also work in a school, in a gym. You could work at a grocery store and help people pick out their food while they're food shopping. You can even work for yourself by having a private practice where patients come to your office and see you. In my time as a dietitian so far, I have worked in a school overseeing the breakfast and lunch programs. I have worked in long-term care where I help seniors get the nutrition they need to keep going. And I have worked in a rehabilitation center, helping those recover from drug and alcohol misuse. Now I work for the City of Philadelphia Department of Public Health, and I see patients one-on-one to discuss their diet and their eating habits and come up with goals and recommendations for them to improve. A typical day for me looks like talking to patients one-on-one, asking them about their eating habits and their diet, coming up with goals and recommendations for us to work towards. But there's actually a lot that goes into that besides those things. For one, I have to try to build trust with my patients because food is something that is so personal. Our eating habits are something that's so personal, and sometimes it can be difficult to talk about those things with a professional. So building that trust is very important. I help patients see if they have access to healthful food options because there are many people that I work with, communities of color, that live in food deserts where they don't have a grocery store nearby, or maybe the one that they have doesn't have any quality fruits and vegetables available for them. So looking for different options for them to get different fruits and vegetables so they can make some healthier choices. I also try to work collaboratively with patients, so I'm not the one telling them what to do, but together we come up with goals that they want to work towards, and together we plan out the steps to reach those goals. I see a lot of patients who have different health conditions like diabetes or high blood pressure, and I also see some patients who just want some general nutrition advice, just to live a little bit healthier. By being a dietitian working in public health in the City of Philadelphia, I have a unique role in helping those that I serve redefine what healthy eating looks like for them. Many patients come in thinking that they need to give up foods that they enjoy or foods that are a part of their culture in order to be healthy, but that's not the case. My goal as a dietitian, especially working with communities of color, is to help my patients and empower them to make healthy eating work for them in ways that represent their cultural identities. If you think a career in nutrition and dietetics could be for you, please visit the Academy of Nutrition and Dietetics website at www.eatright.org and find an accredited nutrition and dietetics program. Consider becoming a student member today. Thank you for watching.